Daily cleaning of the collar and the skin beneath is an important part of treatment and will help prevent skin irritation. Start by removing or opening the collar front. While cleaning the skin, check for any redness, irritation, and debris under the collar. To check the occiput, a log roll may be performed. Wipe down the patient with mild soap and water and wipe dry. To change or clean the padding, remove the back shell from behind the patient's head. First, remove the pads from the plastic collar shells. Wipe the plastic collar shell clean with mild soap and water. Hand wash the pads with mild soap and water. Rinse with clean water to remove soap. Squeeze in a towel to wring out excess water. Lay out flat to air dry. A replacement set of liners may have been provided with the collar to alternate sets. Replace the pads by folding in half and attaching the gray side to the inside of the collar. Ensure the padding extends beyond all plastic edges. Repeat these steps for the back shell. Reapply the collar according to the clinician fitting instructions and securely refasten the straps symmetrically.